Top 25 Health Services Assistant Interview Questions and Answers. Preparing for a health services assistant interview requires more than knowing basic healthcare duties. Employers want candidates who can demonstrate compassion, reliability, communication skills, patient safety awareness, teamwork, confidentiality, and the ability to remain calm in challenging situations. In this guide, you will find 25 commonly asked health services assistant interview questions with professional sample answers. Each answer is designed to help you understand what interviewers are looking for while giving you a strong framework for responding confidently. Use these examples to practice your own experiences and show how your skills can support patients and healthcare teams. 1. Tell me about yourself. I am a compassionate, reliable, and organized professional who enjoys helping people and working as part of a healthcare team. I understand the importance of treating every patient with dignity, patience, and respect. I am comfortable following procedures, maintaining confidentiality, communicating clearly, and supporting healthcare professionals with daily tasks. I also remain calm when situations become stressful and understand the importance of patient safety. My goal is to provide dependable support while creating a positive and comfortable environment for patients, families, and colleagues. 2. Why do you want to work as a health services assistant? I want to work as a health services assistant because I enjoy helping people and contributing to their well-being. This role allows me to combine compassion, communication, organization, and teamwork in a meaningful healthcare environment. I understand that assistants play an important role in supporting patients and healthcare professionals. I am motivated by the opportunity to make patients feel respected, comfortable, and cared for. I also appreciate the opportunity to continue learning, develop healthcare skills, and contribute positively to the overall quality of patient services. 3. What are the main responsibilities of a health services assistant? A health services assistant supports patients and healthcare professionals with various daily activities while following workplace policies and safety procedures. Responsibilities may include assisting with patient comfort, preparing rooms and equipment, maintaining cleanliness, communicating observations to appropriate staff, supporting administrative tasks, and helping patients navigate services. The exact duties depend on the healthcare setting. I understand that every responsibility should be performed carefully, professionally, and within my scope of practice. Patient dignity, safety, confidentiality, and effective teamwork would always remain important priorities. 4. How would you handle a difficult or upset patient? I would remain calm, respectful, and patient while allowing the individual to explain their concerns. I would listen carefully without interrupting and acknowledge their feelings rather than becoming defensive. If I could resolve the issue within my responsibilities, I would do so professionally. If the concern required clinical judgment or authority beyond my role, I would involve the appropriate healthcare professional or supervisor. My priority would be to reduce tension, protect the patient's dignity, and ensure that the concern is handled safely and appropriately. 5. How do you maintain patient confidentiality? I maintain confidentiality by treating patient information as private and only accessing or discussing information necessary for my responsibilities. I would never discuss patient details in public areas, with unauthorized individuals, or on social media. I would follow organizational privacy policies and carefully protect physical and electronic records. If I were unsure whether information could be shared, I would ask my supervisor or follow established procedures. Respecting confidentiality builds trust with patients and demonstrates professionalism, responsibility, and understanding of healthcare privacy requirements. 6. How would you prioritize your tasks during a busy shift? I prioritize tasks according to patient safety, urgency, deadlines, and instructions from healthcare professionals. I first identify responsibilities that directly affect patient well-being and then organize less urgent duties around them. I remain flexible because healthcare situations can change quickly. If several urgent requests occur simultaneously, I communicate with my supervisor or team members rather than making unsafe assumptions. I also keep track of completed and outstanding tasks. Good organization, communication, and situational awareness help me remain productive without compromising the quality or safety of patient care. 7. How would you respond if you noticed a patient becoming unwell? I would take the situation seriously and immediately follow the healthcare facility's established procedures. I would quickly notify the appropriate nurse, clinician, or supervisor and provide clear information about what I observed. I would remain with the patient if appropriate and within my responsibilities while waiting for assistance. I would not attempt procedures outside my training or scope of practice. Afterward, I would accurately document or report the incident according to policy. My priority would always be patient safety, prompt communication, and appropriate escalation. 8. How do you work with nurses and other healthcare professionals? I work with healthcare professionals by communicating respectfully, following appropriate instructions, and understanding my responsibilities. I believe effective teamwork depends on reliability, clear communication, and mutual respect. I listen carefully when receiving instructions and ask questions when something is unclear rather than guessing. I also communicate relevant observations promptly so the appropriate professional can make decisions. I understand that healthcare is a team environment, and every role contributes to patient outcomes. I would support colleagues while remaining accountable for my own responsibilities and professional conduct. 9. What would you do if you made a mistake? If I made a mistake, I would take responsibility and report it promptly to the appropriate supervisor or healthcare professional. I would not hide the error or attempt to change records improperly. I would provide accurate information about what happened and follow the organization's procedures for correcting or documenting the situation. I would also reflect on why the mistake occurred and identify steps to prevent it from happening again. In healthcare, honesty and patient safety are extremely important, so I believe transparency is essential whenever an error occurs. 10. How would you handle a patient who refuses assistance? I would respect the patient's right to make decisions while remaining professional and supportive. I would calmly ask whether they are comfortable explaining why they do not want assistance. I would listen without pressuring them and provide information within my role if appropriate. If the refusal created a potential safety concern, I would promptly inform the relevant healthcare professional. I would document or report the situation according to workplace procedures. My approach would be respectful, non-judgmental, and focused on maintaining the patient's dignity, safety, and rights. 11. How do you ensure patient safety? I ensure patient safety by following established procedures, maintaining a clean and organized environment, communicating concerns promptly, and staying within my level of training. I pay attention to potential hazards such as spills, clutter, incorrect equipment placement, or changes in a patient's condition. I also follow infection prevention practices and use appropriate protective equipment when required. If I notice something that could place a patient at risk, I report it immediately. I believe patient safety is everyone's responsibility, regardless of their specific position within a healthcare organization. 12. How do you deal with stressful situations? I manage stressful situations by staying calm, focusing on immediate priorities, and following established procedures. I avoid reacting emotionally and instead consider what needs to be done first to protect patients and support the team. If I need assistance, I communicate clearly with a supervisor or colleague. I also try to remain organized throughout the shifts so that stress does not lead to missed responsibilities. After a difficult situation, I reflect on what happened and consider whether there are ways I can improve my response in future situations. 13. How would you communicate with an elderly patient? I would communicate with an elderly patient patiently, respectfully, and clearly. I would speak at an appropriate pace, use simple language when necessary, and give the patient enough time to respond. I would avoid assuming that hearing, vision, memory, or mobility limitations apply to every older person. I would maintain eye contact when appropriate and listen carefully to their concerns. If communication difficulties occurred, I would use approved support methods or involve the appropriate professional. My goal would be to ensure the patient feels heard, respected, comfortable, and included. 14. How do you handle confidential conversations in public areas? I would avoid discussing confidential patient information in public areas whenever possible. If a conversation involves sensitive information, I would move to an appropriate private location or follow the organization's approved communication procedures. I would also be careful when discussing information over telephones or electronic systems. If someone nearby asked about a patient's condition without authorization, I would politely explain that I cannot share confidential information. Protecting privacy is part of professional healthcare practice, and I would consistently follow organizational confidentiality and information security policies. 15. What would you do if a colleague asked you to perform a task outside your training? I would respectfully explain that I am not trained or authorized to perform the task and would not carry it out simply because someone asked me. Patient safety must come first. I would contact the appropriate supervisor or qualified professional for guidance and assistance. I would remain willing to help in another appropriate way within my responsibilities. I believe understanding professional boundaries is essential in healthcare because performing an unfamiliar or unauthorized task could place both the patient and staff member at unnecessary risk. 16. How would you deal with an aggressive patient or family member? I would remain calm, professional, and respectful while maintaining appropriate personal safety. I would listen to the person's concern without responding aggressively or arguing. I would use a calm tone and try to understand what caused the frustration. If the behavior became threatening or unsafe, I would follow workplace procedures and seek assistance from a supervisor or security staff when appropriate. I would not attempt to physically intervene unless specifically trained and authorized. My goal would be to de-escalate the situation while protecting patients, visitors, colleagues, and myself. 17. What does good patient care mean to you? Good patient care means treating every individual with dignity, compassion, respect, and patience while supporting their physical and emotional needs. It also means following safety procedures, communicating effectively, respecting privacy, and recognizing when a concern needs to be escalated. I believe patients should feel listened to rather than treated as tasks on a schedule. Even small actions, such as speaking politely, maintaining cleanliness, or responding promptly, can make a meaningful difference. Good care combines professionalism with genuine concern for the patient's comfort, safety, and overall experience. 18. How do you handle repetitive tasks? I understand that healthcare includes many routine responsibilities, and I approach repetitive tasks with the same level of care each time. I focus on accuracy rather than rushing simply because a task is familiar. I use checklists or establish procedures when appropriate and remain aware that routine duties can directly affect patient safety and comfort. I also look for efficient ways to organize my workload without skipping required steps. Maintaining consistency, attention to detail, and a positive attitude helps me complete repetitive responsibilities reliably throughout my shift. 19. How would you respond to a complaint from a patient? I would listen carefully and allow the patient to explain the concern without interrupting. I would acknowledge their frustration and remain respectful, even if I disagreed with their perception of the situation. If the issue were within my responsibilities, I would try to address it appropriately. If it required a supervisor or healthcare professional, I would escalate it promptly. I would avoid making promises I could not keep or blaming other staff members. My objective would be to ensure the patient feels heard while following the organization's complaint handling procedures. 20. How do you maintain cleanliness and infection control? I maintain cleanliness by following the healthcare facility's infection prevention procedures and using appropriate protective equipment when required. I understand the importance of proper hand hygiene, cleaning frequently touched surfaces, handling waste correctly, and following procedures for contaminated materials. I would also report spills, hazards, or environmental concerns promptly. I would never assume that a routine area does not require attention. Consistent infection control helps protect patients, visitors, and staff. I would stay updated on workplace procedures and follow instructions carefully rather than taking shortcuts. 21. How would you handle multiple requests from patients? I would remain organized and determine which requests are urgent and which can safely wait. I would acknowledge each patient so they know their request has been heard, then prioritize according to safety and healthcare team instructions. If several requests required immediate attention, I would communicate with my supervisor or colleagues for support. I would avoid promising unrealistic response times. Clear communication helps manage expectations and prevents confusion. My goal would be to provide efficient assistance while ensuring urgent patient needs receive appropriate priority and attention. 22. Why is communication important in healthcare? Communication is essential because accurate information can directly affect patient safety, teamwork, and service quality. A health services assistant may notice changes, patient concerns, environmental risks, or important information that healthcare professionals need to know. I would communicate observations clearly, promptly, and through appropriate channels. I would also listen carefully to instructions and confirm information when necessary. Good communication reduces misunderstandings, supports teamwork, and helps patients feel respected. I believe effective healthcare communication should be professional, compassionate, accurate, and appropriate to the situation. 23. How would you handle a patient who is anxious or frightened? I would approach the patient calmly and respectfully, introduce myself, and listen to their concerns. I would avoid dismissing their feelings or telling them not to worry. Instead, I would provide reassurance within my role and explain what I can do to support them. If they had questions requiring clinical information, I would involve the appropriate healthcare professional, rather than providing information beyond my training. My calm behavior, patience, and respectful communication can help create a safer and more supportive environment for an anxious patient. 24. What are your greatest strengths for this position? My greatest strengths are compassion, reliability, communication, attention to detail, and teamwork. I understand that healthcare assistants need to be dependable because their work contributes to the smooth operation of patient services. I am also willing to learn and accept feedback so I can improve. I take procedures seriously, especially those related to safety, confidentiality, and infection control. I believe my ability to remain patient and professional during challenging situations would help me build positive relationships with patients and colleagues while supporting the healthcare team effectively.